If you want to know how to go from sports PT to a healthcare provider and become that next generation of clinicians and why it's important, you need to tune into this episode. Hi, everyone. Welcome, all new listeners, and welcome back to those who heard my content in the past. I'm excited for today's podcast. Before I go on to the content, what is new? What is better? For those of you who follow me online, there's always something. There's always something, and I know it's just not me. It's you. Whether it's your car, your house, your tooth, your something is always happening in our lives that is just blocking us from going to that next level. And you all feel it. And I'll share mine. So, those who follow me online, on Monday, January 22nd of 2024, whenever you listen to this, I have a private practice, a cash-based private practice. I have three locations, and one of my locations flooded, absolutely flooded. And it's not the first time, it's actually the second time. It happened again last year, February 25th of 2023. And it has been an incredible journey to get here today to do this podcast because there's been a lot of chaos and a lot of management. I've had my hand in water, in junk, in cleaning up and cleaning products and lifting things. My hands hurt, my feet hurt. I've been coming home at midnight, waking up at 5, and it has been a lot. And for those of you who are out there, we all have those things. And you know, you've been listening to my podcast for the last few months. It's been tough from a health perspective in terms of my family and my extended family. I had family members on my wife's side pass, and I've had my immediate family also have challenges. And there's just a lot of health conditions going around. And I had somebody I know personally had their gallbladder removed, or excuse me, their appendix removed. My daughter knocked her two teeth out in the front of her mouth, and those are permanent. Now we have to wait till the big ones come in, the adult ones. Our dryer broke. Our dishwasher is having an issue, and just so much. And the cool part about this is that it's not just me, right? It's all of us. And I had part of the part of the process to recover from this flood. I had a news reporter who showed up, and they were able to help share our story of our business. And if you're interested on that, you can follow me on Instagram. It'll be on there. But they asked me a good question. They said, "How does this make you feel?" And I was like, "Well, what emotions do you want?" And it really just hit me all in one. The real struggles of being a small business owner, the real struggle of being a physical therapist, the real struggle of being a husband, the real struggle of being a dad, the real struggle of trying to stay fit and healthy and mentally stay sane through all of this stuff. And I just broke down. That question was so great. It was, how do you feel? And I was like, you know, I don't ask myself that question so much. And it was just tough to maintain composure. So it has been quite the week. But nonetheless, I'm here. I'm passionate. I'm excited to share with you what one of the deeper conversations I had with someone on my Kickstarter 8-week online mentorship program. And that same conversation I had with a team member of mine at Sports Performance Physical Therapy. And then I also had that same conversation with a Zoom call that I had with a physical therapist that I'm mentoring with um, an expertise that I'm developing and sharing with the rest of PTs all over the US and actually all over the world, that I'll be launching very, very soon, which I'm really excited about to be able to help you because these patients are coming to see you, but with stem cells. So, and these three discussions I had all kind of spoke to the same message. And I'll share what this is. Today, we're going to talk about how sports PT is an entry point for a lot of people. And I'm writing some things down here. Sports PT it's an entry point for a lot of us, right? We're so passionate about. I had a someone in my sports PT academy mention. I said, Chris, I love being in your Kickstarter mentorship course, and I said, why? They said, uh, I feel like this is where I need to be. And I said, why? Because he goes, because I treat a lot of ortho patients, inactive people, some athletes, active individuals, couch potatoes who want to stay active, high schoolers, ACLs, and my coworkers don't really get passionate about that, right? They don't think like me. They come in, they clock out. They barely do their notes. They're not really passionate about doing things. If somebody cancels, they're excited. If somebody no shows, they're on Instagram, they're on Facebook, they're on their phone. They're not really doing things. And he said, that's not who I am. And I really want to treat active people. I really want to make a difference in people's lives. And I want to get them more fit. I want to get them, performing at their best. I want to get them in the weight room. I want to get them stronger than before. And, he said, being on your sports PT Kickstarter, where there's 38 physical therapists and healthcare providers from all over the US and Puerto Rico, as an extension of the US, it really feels like I am with people that I should be. I feel like I should be there because this is where I belong. Listening to everybody in this call, everyone's asking good questions. I wish my coworkers were like that. I wish I was working in an environment like that. And that's why I built all of my programs and all my courses, because I know it's a rare instance to find that many people who are very passionate about sports PT. And so all of us came in as an entry point to being a sports PT. And then there's different struggles you have as a PT as you enter the profession. You're new grad, super pumped, super excited, and then you get into a job where maybe you work for insurance, a hospital setting, an ortho setting, maybe you're a hybrid clinic, maybe you're a cash-based clinic, maybe whatever it is. Then now you enter the workforce, and now you have the constraints, the red tape on everything that we do as a company, as a profession, as a whatever it is that you do. And now, it's not that easy to see these athletes or see them as long as you want. And now you're realizing the real struggles of being a sports PT. You care more than you can do. I'll say that again. You care way more than you can actually do. And that's frustrating. So sports PT gets us passionate. We're excited. Then we hit a wall. And then maybe you blame it on your company. Maybe it's not the company for me. So you move on to a different company, and that new company is going to solve all the problems. And you realize it's still a struggle. And I truly believe, as I mentored thousands of physical therapists now, I realize there's trends, and it's not like just you, or not just because you live in Virginia or Texas or Kansas or Oregon, and that's how they do it over there. No, you're just a human who has a profession, and those two things are very predictable. A lot of us as individuals, we're very right side of the brain dominant, very analytical, very logical, very empathetic human beings who we enjoy doing certain things. We want to help. That's the person who chooses a profession, and that profession exists all over the state. So now we're not talking about, oh, my state's different or my clinic's different. No, your profession. You're locked into the profession, and that is a big deciding factor on your happiness and what you can do inside your career path. And the more I get to understand, there's these phases. The first 1 to 2, maybe even 3 years, you're super passionate, and then you maybe find another job because you don't like the one you have. Then you get to the 5 year mark, and you're like, man, is this really worth it? Is this really what I what I thought I was gonna do for the rest of my life? Do I really want to take home notes, for 2 to 3 hours? Do I really want to give up my weekends for CEUs? Do I really want to, deal with stinky feet? Do I really want to, insert your challenge? Do I really want to do Medicare evals? Do I really want to do an hour session? Whatever it is that you struggle with, that's the profession, right? That's what we do. And the more and more I see people doing these things, if you don't understand that it's getting out of the profession is not the problem, or changing the job is not the problem. It's just how you see your skill set and what you do for people. Now, PT has given us this box. You're supposed to do movement and manual therapy and corrective exercise. Like that's your toolbox, right? Like that's every toolbox, every CEU course, and every PT instructor and every mentor has told you. You got to get good at manual. You got to get good at your correctives. You got to get good at repeated movements. You got to get good at your movement assessment. You got to get good at your strength and conditioning, whatever it is. So if that's the toolbox, that's what you look at. You're like, well, that's the only toolbox I'm allowed to do. So that's what I got to do. And you only get good at that. Well, what that does, it narrows your lens. It narrows what you can do for people. And if you listen to my last podcast about the PT profession, I think that's a really big deal. And I think it's very critical that we start looking at other avenues. And this podcast is an extension of that. Sports PT is what we enter at. And I'm telling you right now, there's a lot of clinicians around the US that are now starting to think and see it differently. And let me share what this model looks like. Instead of being a sports PT, which you are through your license and your trade, and that's what you are, but what you will be and can be to get you out of this wormhole, this never-ending cycle of frustration of being this provider who just is caught in this doing the same thing all day, every day, and exhausted, is that you will no longer have to see yourself as a sports PT. You have to see yourself as a healthcare provider. And that's why I titled this podcast From Sports PT to Healthcare Provider. It's the next evolution, the next generation of clinicians. And how is that important? How is that different from what I do, Chris? I do these things. I blah, 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 right? You insert your how you're special. But the challenge is you don't practice it. You don't live it. You don't breathe it. I helped somebody create a wellness program for their clinic. And their one thing they wanted to work on was, well, Chris, how do I make myself more marketable? How do I help my community more? How do I get more athletes? The original question was, how do I get more athletes on the schedule? That was the question, right? And they're like, well, I can go to gyms, I can do all these things, I can ask people, I can do those things. I was like, why don't you just take a different approach? Why don't you become the expert? And I said, why don't you design something? So we went through and we designed a wellness program that they would do bring in people. They would create uh, a monthly program for individuals 40 to 60 years old, or 30 to 50, whatever it is, and provide a wellness service where they can use their clinic. They had a huge square footage as a gym that they could come in, 3 times a week, and it'll be a pre-templated program, and they can do it at a very low price, so it's affordable, and that patient can stay active. And what I said was, make that available to your active patients who want to stay more active, or your couch potatoes, your 10% of the bell curve, who now comes towards the center, and you want to keep them more active, and maybe they're done with their visits and you don't know the next phase. Why don't you just build programs for them that every month that they can go in and do, and maybe you advance them and no one has to oversee it. Now that gets them more active. Now you have more active people on your schedule, and they're going to get hurt. So now you have patients who trust you, value you, and just normal life aches and pains. You become their referring, like they just know that they'll need you. They're right there and then. So now you have an active person who's even more active. Now they stay on your schedule. And then you can bring some speakers from all over your local town. And maybe there's a nutritionist or a dietitian that you want to bring on. And now you bring somebody else with a unique skill set and helps educate these people on a Tuesday night, and it's free. Now, patients will come in for sure for free for education or through Zoom. And now you make connections with your local community. And now you have a dietitian you can work with, maybe bring in a personal trainer who can help them, and you now work with them. And now you have more people in your network who can help you develop more skills, not just in your musculoskeletal domain, because that's what we do, but what about everything else that this person does outside of the clinic? And that's increasing their injury risk. For instance, does somebody sleep, 6 to 8 hours? What's their nutrition or diet like? That impacts how much they weigh, which impacts how much stress is going across their knees. So instead of saying, hey, lose weight, why don't we look at, was there anything else we can do from a consulting perspective? Maybe getting a certification in dietetics or nutrition online or through a course, that we can service those people or learn from somebody, bring somebody in. Or maybe you get a CSCS and you look at strength conditioning or bring in a personal trainer or a strength coach to help you guide your patients. And ultimately, you're trying to figure out what is it besides PT that I can offer and help people within my scope of practice? That's the question you have to be asking yourself. So, are there things that your patients are needing or wanting to do that you can't do right now because of your lack of skill set? And maybe you're too zoned in on learning how to tape when the patient wants to know what I should do from a running mechanic or what shoes I should wear or running progressions or a return to marathon progressions or a monthly strength and conditioning program template or a in-house gym that they can use or a uh, better sleep protocol. I mean, what you have to realize is that what our profession sells, what we offer, there's a cap on musculoskeletal health, meaning musculoskeletal health is, if it's insidious onset, it's 100% preventable, meaning that let's assume take out trauma, right? Someone's a car accident, somebody is on a soccer field and they got contacted, hit, and they tore their ACL. That's contact. I get that. But if it's insidious onset, it's 100% preventable. Try and disagree with that. Try and disagree that anything musculoskeletal, insidious onset over time is not preventable. Uh, Osteoarthritis, lose weight, improve bone health, be active, learn how to control what not, doing too much or too little, wear good shoes, stretch, mobilize, get good sleep, and it minimizes them from developing pain. But nobody wants to put that whole package together. Instead, we get the aftermath, the after effect. Oh, you didn't sleep, you didn't eat right, you didn't stretch, you didn't have a strength program, you didn't know how to exercise, you were overweight. Oh, now I got to clean that all up with some magical exercise or magical manual therapy and send you back out to the wolves with you being overweight, inactive, not knowing what to sleep, eat, or do anything else. It's just a never ending cycle. So we're actually doing something that really doesn't do any good for anybody long term. It just gets them out of pain temporarily, but we haven't fixed the root of the problem. How about their health? How about actually getting them in better health, not just musculoskeletal health? Looking at their nutrition, looking at their sleep, looking at their strength conditioning, look at their fitness levels, helping guide them making better decisions in life and health. Why? Because it then reduces how much musculoskeletal junk we have to do. And that's called a healthcare provider. If you want to be a sports PT, you're probably in your first 5 years and you love it. If you love doing sports PT and you're 20 years out, good for you, but you're probably behind your head. As I say this, you've always been thinking, gosh, there's got to be something else I can do. There's got to be. And whether you were looking at another profession or something completely different, you were looking, there's got to be more that I can do for people, not just quad sets, clamshells, hip abductors, the stretchy bandy thingy, the great what are these blaze pods? All those things are great because you're repairing people because they're broken. How about you fix people and not allow them to get broken from a health perspective? And now I love sports PT. Believe me, I love helping people, but I love helping people across a continuum, not in a section of that continuum. That continuum starts with everything they do to recover: sleep, nutrition, hydration. All of those things are then determine how well their body feels and reacts the rest of the day. Then they stay in they work on a computer because they have no education on what to do from ergonomics or whatever it is. That's a solution we can provide. Ergonomics, great. Then they go to a gym in that same slouch posture, perform deadlifts. They haven't done it since high school, and now they just go out with a bang. And let's try it again. Let's lift heavy. Poor mechanics. Perfect. Now we actually can help with mechanics and helping people figure out, is this the lift that you need to be doing? How about we outline something different and revamp the whole thing? Well, now if you have a sports PT, you know what they're going to say is, well, let's just do more clamshells. Let's just do more weight. I can say that I'll improve your strength program and everything else. I actually don't know how to do it, but I'll just say that I can, and I'll add more reps, more sets, more load, more exercises, more everything when there's no strategy involved. So now don't say that you can't help them. You can. It's just developing the skills. How much should they sleep? What position is best? What about their nutrition? I don't know, Chris. How much should they learn? What about water intake? What can they do to minimize the risk of being a junk-based patient? Now they're all junky, they're all injured and everything else. So what would you do if it was a perfect model from the beginning? You'd work on those things, help them lose weight, figure it out, improve their exercise regimen, keep them motivated, put them in better shoes, help them understand what running progressions are, helping understand what fitness progressions are. You can't go from 0 to 7 days in 1 week. Help them understand that, guide them. But this is a long game that requires that people are your patients for a year. That's why I'm not putting them into the context of a sports PT, because they're patients, they're hurt. That's not the continuum. Now, how can you be a healthcare provider that manages their care across a year, a lifespan? It is within our context. It is within our scope of practice. Why not? Musculoskeletal health, reduce the risk via weight loss, health, lifestyle modifications. You can't recommend those things. Well, I don't know the liability and legality. How about you just be a good human and ask and direct them in the right place then? Tell them where to go, but you won't even go that far because you want to stay so laser focused in on the repair mode. And if you need to be able to go from this small lens of a sports PT, I'm doing it great. I'm mobilizing. You're mobilizing problems that could have been prevented. That's the frustrating part to me. Now, why am I so passionate about? If you can't hear this in my tone, why am I so passionate? Because I've lived the life. I've lived it and I've seen the dark side, and it is amazing to live on this side. Now, um, it's not has nothing to do with my cash based setting. People say like, "Well, it's easier when you're cash." No, 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 no. Don't do that. Don't do that. The same struggle exists. I learned it because I worked in pro sports without restrictions. I traveled around the world with athletes as their main provider, and I figured out real fast exercise doesn't get them better when I travel with them 7 days a week, 4 to 6 months at a time. That doesn't work. Exercise is not the solution. Your hands are not the solution. Repeated exercise are not the solution. Taping is not the solution. It's understanding what they do on a day-to-day basis, weekly basis. All right, well, let's take a step back. What's your day look like? Well, I wake up at 7. I go eat breakfast. What do you eat for breakfast? Cereal. Let's change that. That way you can change up your recovery process. Let's switch it up to something a little more wholesome. Eggs, whatever you design. Great. And then what do you do? Well, I go and I get ready for practice. All right. What do you do? Well, I put my shoes on and I start warming up. Okay, great. How about we do a total body warm up? Let's get your heart rate up, and then we'll do some dynamic stretching, and then we'll move you forward. Great. We worked on your stretches. Great. And then what do you do? Well, during my technical practice, here's all my drills. Perfect. Now I can work with your coach and understand what you do. That's not my side, but if I understand it, that helps me. Great. What do you do afterwards? Oh, I go back and I go to my room. Perfect. Here's what we're gonna do. We're gonna do a 5 minute cool down, and then we're gonna do some recovery processes. We'll get you on a cold plunge, and if we have saunas or whatever it is, or Normatex or recovery, whatever it is, we'll get you on that. So you're making smarter decisions. Oh, great! I didn't know that. Great. And what would you do afterwards? I don't know. I just watched Netflix for a couple hours. Got it. Why don't you? Let's focus on getting you a 30-minute nap so you can have some recovery. And then what would you do after that? Well, I go eat lunch. Perfect. What'd you eat for lunch? A grilled cheese. Oof, let's clean that up. After that, what'd you do? Oh, perfect. All right, you go to the weight room. Awesome. Let me go in the weight room and understand what your lifts are. You've been struggling with back pain. How about we don't do full squats? How about we don't do pulling from the ground? We do it from a block. We use dumbbells. We modify these things. Great. Didn't know that. And what did you do after that? Perfect. I didn't do anything. Perfect. Let's set you up for massage or rehab or stretch and get you fine tuned so that you're ready to go for the next day. Now, when you're controlling all of these variables on a day-to-day basis, now you're understanding, oh my gosh, they're not fueling properly. So they're already in a hole from a nutrition standpoint. And now you now are modifying all their lifts, you're modifying their technical practices so they reduce the risk of injury. So you've refueled them and improved the recovery process, decreased their injury risk, and now they can withstand a whole week of training. Versus if you did the opposite and did none of that, guess what? They pulled their hammy on Friday, and now you're the super sports PT to come in and say, "Oh, don't worry, I have all the magical tricks. You're going to be out for 4 weeks, but I'm going to have a really good time for the next 4 weeks helping you out." Or you could have prevented those 4 weeks of injury. Which one do you want to be? Somebody who gets people out of a hole and takes pride in that, or somebody who keeps people healthier than ever, keeps them away from injury, happens to know how to fix them in case they do, or is just managing them closer to their baseline and above. I love being baseline and above because it's so much easier to be a provider. I don't have to dig somebody out of a hole and I don't have a timeline to reach. And this is the reality with pro sports that you don't have these timelines. If LeBron James or Tom Brady gets hurt, they don't have a lot of time. They're paid a lot of money and they got to get them fast. That's a lot of pressure. Or you do all the work on the front end to avoid them from getting injured. And that's not being a sports PT, that's being a healthcare provider, working on all the aspects of what else can add stress to their body or to that local area that has a history of pain that can reduce the risk of it developing or flaring up. That is the art, which requires so much background on understanding what their day to day is, their week to week, their month to month. The counter to this is that you have a sports physical therapist who have you have a patient who has 4 weeks of pain. They come in with knee pain and they have lateral knee pain. This is what you do. You look at the impairment, you watch him squat, you watch him kneel. You're like, oh, knee valgus, poor ankle mobility, poor hip mobility. Awesome. I'll figure it out. Let's get you on your way. And you work on the hip mobility, you work on the knee mobility, you do the manual, you do all these things and the fancy exercise, stretchy bandy thingy. And it takes you 4 weeks. You're like, oh, I did it. But then in that 4 weeks, that person's deconditioned. They're out of shape. You didn't consider all the variables. They couldn't go back to practice. The coach doesn't like you. The strength coach doesn't like you. Why? Because you were so narrow focused on what the injury was that you forgot to ask, oh my goodness, do you have practice? When do you have practice? When do you recover? Oh, I didn't realize you were in the strength weight room. Wait, when were you in there? Oh, you had a competition coming up. I didn't manage those things, but I got your knee pain better. But you missed two important tournaments, and the strength coach is not in line with what I did, and now they don't like me. Well, no wonder why sports PTs can't get along with other professions, or it's harder for you to develop those relationships. You're not considering them and what they do for the athlete. They're at the center of it. And so what you have to do is take a nice step back and understand you service the athletes and by managing their health. And if you can't manage them all by yourself, you're now part of a spider web, a Venn diagram of professionals that all have their hands on this. You just have to understand what context you're playing within what role. So if you have an athlete who's hurt, you take precedence. Once they're not hurt, strength coach and coach take precedence, and you're just there to support in case they fall. Now, if that athlete has none of that and no resources, now you get to play. Now you get to play on wear all of those hats. The problem is you don't have the skills, or you're scared to do it, or you're hesitant, or you don't even know what you can do. That is a healthcare provider. So, ideal world, there will be a new generation of sports PTs, usually around their 3 to 5 year mark, where they're like, yeah, this is not what I envisioned as a sports PT. I wanted to do more exercise and do all these things. And what you're going to realize is you're not getting the outcomes you want. You can, but they're short lived, or they have flare ups, or they keep coming back. Your goal is, can you keep people at baseline or above? And that requires that you understand your role and how to develop more skills so that you can help people across a lifespan, not just across impairments. And if you can process that, you will move on to that next level. The next goal is, where do you learn all this stuff? Where should I pay attention? I think the biggest thing is, all right. And I did this with my my academy members. You look at, you can plan for the next year. What's the skill set you want to develop? What's the thing that you're seeing a lot of that you don't feel very comfortable with, or that you're not seeing a lot, but you want to develop relationships or you want to develop a skill set? This is where you have to look at, okay, what over the next year, what skills do you want to develop? What skills do you lack? What do you want to develop? And what would make you more enjoyable, more marketable inside your clinic? So if you work at an outpatient ortho and you're looking at, well, how do I get better at providing wellness service? I want more active people. Maybe it's doing this gym program. Maybe it's doing strength conditioning programs. Maybe it's doing injury prevention screens. Maybe it's doing a year of care plan. Now you have to take courses to find those, but you have to figure out what do you want from the top down. Instead of looking at what skill do I want, it's what's the outcome I want, and then develop the skills to achieve that. Most people do the opposite. They don't look at the outcome. They're just like, let me just develop more skills. That's a taping course. Let me just take that. That's a knee course. Let me take that. That's a back course. Let me take that. But never do we develop an understanding of what do we want at the end of this year. What's the solution you want? What if you ask yourself, what in 1 year would make the biggest difference to my professional development and my personal happiness at work? What courses would help me do that? Well, first, you have to figure out what that problem is. So instead of looking at more knees and more ankles, more backs, more necks, what is it that you can do to figure out as a healthcare provider, what skills do I want to do on the recovery side, the injury prevention side, the strength conditioning side? What aspect do I want to enhance? And then figure out the courses from there. This is what I do with my team. This is what I do with myself. And it helps. Now you see exponential growth versus the clinician who has worked 1 year 5 times over. So you hear people say, hey, I've been practicing 5 years. No, you haven't. You've been practicing 1 year 5 times versus exponential growth. Oh, I'm a different physical therapist. Got it. I understand. I can now do injury prevention programs. I can now do strength and conditioning programs. I can now manage acute injuries. I can now do, nutrition. I can now do sleep. I can now manage anything that people throw at me within my purview, within my scope. And that is the dream. And it's not under a sports PT. It is truly a healthcare provider. I'm very, very passionate about this. It is the next generation. I've been doing this for about a decade now. My first 5 years were a little different as I became a healthcare provider and working at the United States Olympic Training Center. That's what really like changed my vision. It changed my view of what I do. And the minute I applied it to my community, that's why I say it's not cash-based business. I have 3 locations as cash-based business. I mentor physical therapists. I see the struggle that people have. Even if you had unlimited resources and that you had all the time in the world, you had the best equipment, you still couldn't do this. Why? Because you still need the skill set and the view of what you do. Gain that first. It has nothing to do with the setting you're in. It's not insurance limiting that. You can still have those conversations. You just need to develop a skill, offer it to the person, and then find the next struggle, them seeing the value in that. Why would I need that? Oh, I see. I haven't even discussed the benefit to you. Perfect. It actually, so you don't have to see me and miss 6 weeks of your games. So this would ensure that if I just see you monthly or every other month, this reduces your risk. I think I'd rather see somebody 6 sessions every other month across a year with no injuries than 3 times a year with the same hamstring. They lose time, money, effort, motivation. You get frustrated. So everyone would be happier if you just saw them less in pain. That's a healthcare provider, and that's what we will be doing differently. And for those who keep getting stuck in the rat race, the same knee, the same back, the same ankle, whatever it is, you'll see that, man, like, is it me? Is it my job? Is it this? Is it that? Let me take a knee course. Let me take a back course. I'll change jobs. Let me take a knee course. Let me take a taping course. Like it's just this circle. So if you're looking at how do I expand the circle so I have more things that I can control my variables, that's looking at how do you become a healthcare provider. So there you have it. I really wanted to get that in your brain. It's numerous conversations I was having, and the person I was discussing with was asking about stem cells. And in stem cells, the first month of having stem cells, you're actually doing minimal progressive overload. And they asked, well, then what am I doing? And I said, you know what? There's still value in coming to see you because your job is to protect all the other stressors to life that can minimize the healing to the stress to the stem cells. So, for instance, if it was a knee injection, you're trying to minimize the stress to the knee. And they said, well, can I do step ups or anything else? No, 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 I don't want any weight bearing things. And he said, well, then what am I doing? I was like, you're protecting everything else. So, what are they doing at work? What are they doing from a fitness standpoint? What do they do for sleep? What are they doing for nutrition? What do they do hydration? All these other things. And he said, wow, so I'm actually not progressing them. I'm minimizing the risk of injury or flaring things up for the first weeks. That's exactly it. but it's not how we think as clinicians. What we think of is how do we push more, how do we progress, how do we do more, how do we do these. But there's individuals or cases where you have to control the external stressors is more important than what you're doing inside the clinic, and that is mind blowing to a lot of us. And you have to be able to switch that zone to being a healthcare provider. So I'll release more of the stem cell things. I have a home study mini course coming out to be able to help support physical therapists who are seeing them. We are a huge network for individuals who are undergoing stem cells. So the question and challenge people have is, I don't even know what to do with them. Do I treat them like a PRP? No. Do I treat them like post-op? No. They are their own unique case where they still follow healing timelines, but they are adjusted based on the type of stem cells and everything else they're doing. You don't want to mess these things up. They're very expensive, many zeros in that dollar amount. So I'll come out with that later, probably the next month or two, and share that with you. So I hope you guys are doing amazing. I hope this really gets you in the mindset of, man, what does my career look like in the next year? Is it a sports PT? Is it a healthcare provider? What is it that I'm doing that's going to make me happy and fulfilled over the next 5, 10, 15, 20 years? Instead of looking for another career, another path, start considering, is it my view of what I do, and what's the skill set I need to do to change that view? So I hope that helps, and I hope you guys are doing well. Thank you all for those who reached out and asked if we need any help with our flood. I truly support you, truly appreciate the support. I didn't realize how much of a community we have inside Sports PT and across the country. So I absolutely love you guys. You guys are amazing. Thank you for the support, and I'll see you guys on the next episode. Take care.